of a part of the medial malleolus. And a saphenous cut down is just basically making an incision in that area, and a cannula is a thin tube that you put into this particular vein or others, and you can basically administer medicinal fluids, drain fluid from an area, and kind of put in surgical instruments into the area to, let's say, clear up certain blockages or something that might be nearby and around. So the saphenous nerve accompanies this great saphenous vein, and if you kind of cut incorrectly, you can sever this saphenous nerve, which is shown right here, and kind of follows this saphenous vein down. And if you go ahead and sever this nerve, you're going to have some pain or numbness along the medial border of the foot. And so that's looking at this side here. And so we'll take a look at this saphenous nerve briefly in another context, and take a closer look at this whole picture here in the anterior side of the lower limb with some nerve innervation. And I'll stress to you what I want you to know, and things that I don't really want you to know about this for exam purposes. So keeping on with this venous drainage of the lower limb, which is where we left off last time more or less, I told you that there were two superficial veins, the great and small saphenous veins. These are the two, let's say, main superficial veins. The small saphenous vein, I already went over the great one last time. The small saphenous vein arises on the lateral side of the foot from the fifth digital with the dorsal venous arch. So that's different than the great saphenous vein, which arises nearby the first toe. Okay, so just keep in mind that they're on opposite ends in terms of their origin to traverse then the leg of the lower limb. It ascends posterior to the lateral malleolus. The great saphenous vein ascends anterior to the medial malleolus. And so here we're looking at something that's posterior on the leg when we're talking about the small saphenous vein. It inclines to the midline of the fibula. We know that the fibula is a lateral leg bone, and it penetrates into the deep fascia to enter this area here called the popliteal fossa. And so here it enters into this popliteal vein. And this is a deeper vein of the leg, and remember the small saphenous vein is a more superficial vein, so it has to sort of penetrate that fascia because the definition of deep or superficial is relative to the fascia that we talked about, the crural fascia in the leg or the fascia lata in the thigh. So this ascends between the gastrocnemius muscles, which are located right here before it kind of pops into this popliteal fossa. And as I mentioned, it empties into this vein. So there are some perforating veins, and these are general terms used to describe veins to say that penetrate deep fascia or enter through a muscle. This is not, let's say, a particular vein located in one particular site of the lower limb. We can be talking about veins in the leg, or we can be talking about veins in the thigh when we're talking about perforating veins. So these guys basically penetrate the deep fascia close to their origin. In particular here, we happen to be looking at perforating veins in the leg. Then these guys basically move from a superior area and go deeper. Compression of these perforating veins prevents blood flow from moving from the deep to the superior aspect. And so in other words, you basically let blood flow to the heart without backflow, because the fascia that's around these perforating veins sort of squeezes them as the muscles tense. And this is a concept that we talked about before, to efficiently move blood from the venous circulation into the heart via the vena cava. So there are these deep veins, and in general, deep veins accompany all the major arteries. This concept, we looked at it very early on in the semester, L vena, venia comitantes, and these are basically when you have these veins that are ensheathed with arteries with connective tissue. And so as the arteries themselves expand with blood, that helps the venous return back into the heart as well. And so we have this vascular sheath proximal to an artery. The deep veins also have these sort of tributaries that, again, enter into this popliteal fossa, popliteal vein, which then goes upwards, and it's a continuation of the femoral vein, and we'll take a look at that in a second. But basically, what this is showing you is that there's some deep veins, including this popliteal vein, that feeds back into the femoral vein, which you should know by now, hopefully, is associated with the external iliac. So this image here basically kind of begins to expand the view of venous drainage in the leg, and hopefully kind of add on to this lower limb and integrates the ideas that we looked at for the saphenous veins that were more superficial, because these are the deep veins. And so remember, blood flows from these superficial veins into these deep veins. And so there are, as we mentioned, these other deep veins from the leg that actually move into the popliteal vein, itself a deep vein, and then goes into the femoral vein right here. The popliteal vein should be, here it is, more posterior. And so the blood is kind of moving from this popliteal vein as it gets this superficial drainage from the lower leg and feeds into this femoral vein right here. And then there's a vein associated with the femoral vein called this profunda femoris vein. And this one here basically has certain these certain little branches that wrap around the femur of the leg and eventually feed in to the profunda femoris feeds back into the femoral vein itself. So the femoral vein is the continuation of the popliteal vein proximal to the adductor hiatus. And so this adductor hiatus is important, and we'll take a look at that area when we look at the adductor group of muscles, and we'll see that it attaches to the medial aspect of the femur, which would be here since this is a posterior view. But the main idea here is to have an appreciation for how the femoral vein courses, and when we look at the femoral triangle, we'll also break that down a little bit more. I think that this right here will become clear a little bit later in the lecture. But what I do want you to appreciate directly right now from this particular picture is that this inferior, the femoral vein is in this inferior area of the femoral triangle, and that's sort of where it receives this profunda femoris vein. So just kind of see this, the profunda femoris as sort of like an outbranching that feeds into the femoral vein and kind of stays more or less up around the upper, 2/3 part of the thigh and deals with that area. And also remember that deep veins are intimately associated with arteries, so by knowing femoral vein, profunda femoris vein, you kind of already know a little bit about the location of the corresponding arteries, so the femoral artery and the profunda femoris artery. So looking at lymphatic drainage, here we have some superficial lymphatic vessels which we're looking at. And basically, I'd like you just to associate them in general with the saphenous veins. The lymphatic drainage, as we've kind of seen a little bit throughout the course of these lectures, accompany veins to the lymph nodes. And these superficial ones, which we're focusing on here, basically have a route, the vessels that lead to this sort of external iliac nodes or these deep iliac nodes eventually, whether you're coming from the leg or the thigh. When you're coming from the leg, though, you kind of stop at some nodes here in the popliteal fossa. And so these then would go ahead and proceed to the external iliac nodes. And so when you're looking at drainage of the leg, you're talking about external iliac nodes or deep inguinal nodes, and you're kind of moving there via the popliteal fossa if you're starting off way down in the leg region itself. So what sort of innervation is seen in the lower limb in terms of the skin? And I'm only going to have you guys look at the anterior aspect. We won't be focusing too much on the posterior aspect at all.